So this is another short paper, and I'd like to invite Sarah, Jackie and Suzanne. So I can see Jackie's with us, and Suzanne and Sarah, there you all are. Hello, hi.
Hi.
It's another NHS related talk, I think, is that right?
It is indeed, and
yes,
it's COVID-19.
Okay, and COVID-19 is a very popular theme, and I guess it just affects us all at the moment. So it'll be really interesting to hear your talk. So I shall disappear and let you get on with your talk and monitor the questions. Thank you.
Brilliant, thank you. So hi, my name's Jackie McGuire, and I'm from Northumbria Healthcare Trust. And along with Sarah and Suzanne, we're just here to talk to you about the impact that COVID-19 has had on our two health libraries in the northeast of England. We decided to do it from two perspectives because really there was no one-size-fits-all guidance for us to follow, and we thought it would be interesting for you to see the differences and the shared experiences that we did have. Just about how we're going to look at the positives, the negatives, and also how we adapted to the changes, some of the new opportunities that we found we had, and how we can use our learning and experiences in the future ahead of us, because we're not there yet, we're still changing, we're still learning. We've left some time at the end for you to just share your experiences and also ask us questions. So unprecedented really sums up the past year for me at home and at work. I've learned a new vocabulary, and I've also had new rules to follow. Lockdown, roadmap, circuit breakers, hands, face, space, new normal, to name but a few. Our physical environments all narrowed and they all changed. We were told to stay at home and only go out for a walk once a day, and quite a lot of people were told not to go out at all. This picture of the deer in Newcastle city centre was on our TVs, and it's the one that struck me and still stays with me, because the deer's right in the middle of Newcastle on the empty roads, and this picture just felt really eerie and definitely not normal. Amidst all of this, we had to find a way to continue to run our services and also support our staff. And to be honest, because there was no rules and very little guidance, we knew it wasn't going to be easy. Can I have the next slide, Claire? I'll talk about the next slide. Yeah, that's it. Thank you.
There's a delay, just so you know, there is a delay.
Yeah. Okay, since the start of COVID-19, library services and staff in the NHS trusts have been in a constant change of uncertainty. It's not stopped for over a year. We knew that people were scared and anxious, and also as managers, we wanted to find a way of supporting them emotionally as well as practically. And we found this change curve model useful. A lot of people might have seen it before, based on the 1960s psychologist Elizabeth Kubler-Ross, who documented her observations of the emotional stages people went through during bereavement. And later research established that people go through very similar stages when any major change happens, either in their life or at work. So that can be a change of job role, it can be a loss of job. The first stage of denial and shock was hard, as we all struggled to accept what was happening, and we all felt this, we all struggled with this. At this point, sharing all of the information that we were getting from senior management with staff and answering questions as best we could helped. The second stage of anger and frustration happened as the implication of the changes were processed. Emotions were really high, and keeping communication channels open and trying to support people was vital for health and well-being during this time. Following on from the anger and the frustration, some people get depressed, and there is quite often a feel of sort of low motivation. People don't know what to do, they struggle to behave, they lose energy. Everyone's different, but the rise generally in mental health issues has illustrated how hard this has been for many people. Using things like Teams and Zoom to have coffee breaks and setting up projects that people could work on together helped staff keep motivated and help them support each other during this time. From that low point at the bottom of the curve of depression, things start to go on an upward curve and they start to move through the stages of experiment, decision and integration. There's an acceptance here that there's nothing to be gained from continuing to resist the change, and we try to start to work positively in the new environments and the new situations we find ourselves in. Whilst we have engaged with our new situation, for example, attending virtual conferences like this instead of in person and getting used to wearing masks at work, we're still working through that decision and integration stages. Things are continuing to change, and there's always a risk of going back down that curve towards lack of motivation. Sharing our learning and learning from each other and also our wider networks like this is really important now for us. We used other models during this time as well. It was good to just try and get structure to what we were trying to make sense of. We also did lots of training, but having something like this changed curve, trying to make sense of what we were experiencing, the anxiety and the emotions was something that we felt was really useful. Sarah and Suzanne are going to tell you a bit more about the impact of COVID-19 on the services and staff more practically at Northumbria and CNTW now.
Yeah, thanks. So I'll tell you a bit about Northumbria, if we could have the next slide, please. So that's a photo when it comes up of the Northumbria Trust Library staff and Education Away Day in February 2020, so 15 months ago. And that, because we all work on different sites, was the first time we'd all been together in over a year. So there's a team of 11 of us, including 4 part-timers, and we work across 4 libraries in hospitals in Northumberland and North Tyneside. We all went home on the 23rd of March last year with a laptop, thanks to a project which had bought those to facilitate meetings. Many of our colleagues didn't have laptops, and we didn't have access to our network. We left the library doors open so that people could come in for self-service book loans and to use the PCs. And on the 24th of March, we launched our new virtual library service with a Gmail contact address. One of the first things that we did was to set up a WhatsApp group to message each other, and we shared all of our contact details. Over the next days and weeks, we spent hours on the phone to each other, discussing how to carry out tasks and to share work and to check how we were all coping. To start with, Jackie and I were the only ones who had network access, so we spent a lot of time finding files and sharing them with the others. After a few weeks, the Trust gave us all network access at home and MS Teams, and that revolutionised the contact that we have with each other. We set up twice weekly coffee breaks where the whole team gets together, and this has been used as an exemplar of good practice by our managers. So we could have the next slide, please. Quite quickly, we heard that the other education staff were still on site and that other departments had started moving into our libraries. So we started popping back in to check how things were going, and we gradually made that more formal. By the 27th of April, we started a rota for going back on site. And by then there were sinks at the entrance to every entrance to the hospitals, and there were signs everywhere about keeping 2 meters apart. Many clinical staff were on site and they were really glad to see us. We went in 1 day a week to start with, and then 1 person a day in each day. And by September, we were mostly all back on site. We had little specific guidance about what to do with our spaces, so we went through our Trust's advice and guidance to do our own risk assessment. We got sneeze screens for inquiry desks, we bought gallons of hand gel and dozens of wipes, and we moved furniture to create work and study spaces which were 2 meters away from each other. If you go on to the next slide, you can see that we kept moving furniture over the months, as we realised that if we left any seats out marked "don't use," people would just sit in them anyway. With our team, we had 2 people who were shielding, and Vasanthy went on the secondment to NHS England. Another member of the team stepped up into her role, and that left us with unfilled vacancies. One of the library assistant vacancies we filled by interviewing over Teams, and for that new member of staff, our regular meetings have enabled her to integrate into the whole team much better than we would have managed previously. And while all that was going on, we kept working on planned projects. We moved to a new library management system last July that we share with 6 other trusts across the region. We added 100 laptops into our library management system to lend to staff, and we actually found storage space for all of those as well. We recruited a new member of staff for a clinical guidelines project, and she's now got 3 people helping her. And we've just started offering services to local primary care organisations. And if you go on to the next slide, as with everything else that's happened this last year, there's been positives and negatives for us. The negatives have included all the time it takes to deal with all the uncertainty at every stage things have changed. It's been hard dealing with the lack of face-to-face contact with each other and with our customers, and with the reduced footfall in the libraries. But the positives, the main positive, has been the fantastic teamwork from everyone in our service. Our issue statistics were actually up on previous year, and our article request numbers were only down a little bit. And the recognition of physical libraries as safe spaces for trust staff to recharge was a real breakthrough. The impact we've had across the trust with our fiction and health and wellbeing collections, and the recognition of that from senior managers, has been fantastic, as you can see from these quotes. So I'm now just going to pass over to Suzanne so she can tell you her experience in her trust.
Thanks, Sarah. Next slide when it's ready. So I was reminded in the last few days of a quote that I heard last year, which was, "We are not all in the same boat, but we are all in the same storm." And I think that sums up some of the experience that Jackie, Sarah and I have been talking about over the last few weeks. So CNTW, or Cumbria, Northumberland, Tyne and Weir NHS Foundation Trust, is one of the largest providers of mental health and learning disability services in England. The blue area on the map shows out the geographic spread that our trust covers. Our libraries are mostly based in the northeast of England. As a mental health trust, health and mental well-being runs through everything we do as a workforce. Our trust has taken a cautious approach to the pandemic and to the lifting of restrictions. As a result, our library spaces have been closed throughout the pandemic to our users. Next slide, please. So I lead and manage the library team, and in March 2020, on top of dealing with our own personal experience of adjusting to the pandemic, we began as a team figuring out how to deliver our services wholly online, expecting it would only ever be a temporary measure. We faced practical challenges of waiting for IT equipment to be made available for staff to work effectively from home. Most of the team had never worked in this way, so we spent time figuring out how best to share tasks and access files. Keeping library assistants occupied at home for their full contracted hours became quite a challenge, since they weren't able to fulfil their role in the library. As a result, some staff capacity was identified and offered for redeployment to other departments within the trust, but thankfully it was never required. We were already delivering some of our services online before the pandemic, but we extended this to provide all support electronically. The only exception was switching to a postal service for print books to our workforce on a weekly basis, which I maintained mostly throughout the pandemic. At one stage last year, 3 of our 4 library spaces were occupied by clinical teams to help with their social distancing. Each time I visited one of our libraries, more furniture had been piled up for storage to make space for our Gold Command team, the team with operational responsibility for our response to the pandemic. It became increasingly frustrating and obvious that we weren't going to regain our spaces anytime soon. In the autumn, our team returned to working in 2 of our libraries on a weekly rotational basis to catch up with book processing and regular duties, but this only lasted a matter of weeks before the next lockdown was instigated. Then and now, footfall on most of our sites remains low as the workforce are still being encouraged to work remotely. And finally, the last challenge was many of our projects were paused last year, especially those involving service users, both to keep patients safe, but also due to pressures that the workforce were experiencing. Next slide. But we did have lots of achievements during the last year as well. We're always aiming to make things easier for healthcare staff, but never more so than throughout the last year. We put a lot of effort into saving staff time and effort in sourcing the information they needed to inform decision making. Like Jackie and Sarah, our team held occasional team meetings before the pandemic because we were so dispersed it meant closing our libraries to be able to meet. But staff have felt more connected during the pandemic through the use of a WhatsApp group and weekly coffee chats. The pandemic accelerated the deployment and use of Microsoft Teams within our trust, which has also helped to keep the team connected. We supported the health and well-being of staff by promoting reading for pleasure and by including support materials in health and well-being newsletters. Wobble rooms were introduced on some of our sites. These are quiet spaces for staff to go to decompress when they feel they need it most. And we offered some materials to help enrich these rooms. In terms of marketing, instead of working with our library users in person, we increased the amount of library-related content in staff bulletins and shared these weekly on our intranet. A main feature of this was raising awareness of our ebook collection to try and better support staff whilst working remotely, but many users still reported they preferred a print book. We used the chat function in Microsoft Teams to mention relevant resources at every opportunity we could. And recently we've been trying online reading groups for staff, and we've started a randomized coffee trial to help create new networking opportunities. As Sarah mentioned, we were also part of the implementation of a new library management system last year. And then in the early part of 2021, we also implemented a second new platform within our team called Knowledge Share, which is helping to automate some of our evidence updates. Although the number of book loans has obviously decreased for us because we've been closed, requests for literature searches have continued to increase throughout the year. We also identified some new opportunities to support the sharing of knowledge and learning from the early stages of the experience of the pandemic. We contributed to the design and analysis of a workforce-wide staff survey. And as a team, we also held a retrospect session to review what we wanted to improve for the future. Thankfully, throughout the pandemic, my team have remained well and continue to work from home. Next slide, please. So where next? So we're currently and very slowly returning to working in 3 of our libraries on a regular basis. I say regular, but it's still only 1 day a week. Just as in the first lockdown, just as the first lockdown was a huge change for staff, as Jackie outlined in the Kubler-Ross change curve, undoing restrictions and introducing new safety measures into the workplace is also proven to be a huge change and challenge for some people. But this needs careful planning, communication and compassion. In the past, we've run a staff survey every 2 years to find out which resources our staff use and to inform development of our collection. But this year we're designing a much broader survey and some focus to inform how we can continue to meet user and non-user needs as they adjust to working differently in the future. Jackie, I think that's all of the slides, other than just to open it up for questions at the end.
You're on mute,
I think you're on mute.
Ah, there we go. Right, let me start again. So we've run out of time. You meant a lip read then, but never mind. Right. I'm going to give you one question that I can see in the chat before we move on. We've got a little bit of, we can sort of eke into the break time a little bit. And it's from Jennifer. And she's saying, I think this is with regards to Sarah, but it might be others can add to this as well. So the wellbeing collection, which you talked about, was this something you set up during COVID, or was it something that was available before?
We've had health and wellbeing collections in the library for a long time. We've built them up over several years, but this was the most integrated we've been with the Trust's health and wellbeing offer. So it just kind of got picked up much more visibly.
Yeah, okay, that's great. Well, I noticed that your contact details are put in the chat. So if anybody's got any other further questions, then hopefully they can make contact with you and continue the discussion. But thank you very much for all your efforts, and really interesting to hear about what you've been doing. So thank you.